first of all, let me say a very big thank you to the Robert Koch Institute and also to TUC for this opportunity. I'm very excited to be here. And so, since we don't have a chairperson, I'll give a chairperson to the former president. And then let me also acknowledge all friends in academia, lecturers, students, and my colleagues also from Ghana. Today's delivery is on digital health financing innovations in Ghana, supporting progress towards universal health coverage. So, as a quick background, Ghana became a republic or a state some 66 years ago, had the British as colonial masters. In 57, became independent, and then a republic in the 60s. So from 57 to about 69, we had a health system which was similar to the British system where healthcare was free, so you don't pay anything. But increasingly, it became difficult to finance health properly. So health was free on paper, but in the hospital, it was not free. So somewhere in the 70s, the government introduced what they refer to as user fees, where you had to pay something to help with running the hospital, to keep it functional. And then by the late 80s to 90s, health became pay as you go. In fact, we used to call it in Ghana the cash and carry system. And so by the year 2000, we had an election in Ghana, and we were very lucky that health financing became one of the major topics in the election. And this reminds me of what Professor Reintjes in University of Hamburg taught us, that if you can show the politician the number of votes in the policy, they are likely to come on board and roll out the policy. So in 2000, most Ghanaians voted for that political party that promised to introduce some form of social health insurance. And I'm happy to say that when that government took office in 2000, they did introduce the policy through an act of parliament 3 years into government in 2003. So the National Health Insurance Authority and the scheme was given birth to in 2003 by an act of parliament, Act 650. And this law established 3 things. First of all, it established a national health insurance scheme, which was more or less a social scheme that was heavily tax funded. And so you will hear of premiums and processing fees, but they are just tokens. They are not real, because the premium in Ghana for a year is less than €2 for 12 months. So it's largely not the typical premium. It is only more or less a token to get people to be interested in the scheme. And in 2012, we moved from a mutual-based scheme. So Ghana has about 170 districts, and every district, by the law, had their own scheme, with their own board, with their own staff, and with their own fund. But 4 years down the line, in 2012, through another act of parliament, an amendment, Act 852, Ghana now had a unified health insurance that was centralized with a board and that had presence across the country. And so this year, we are in 2023, that's about 20 years down the line. And I'm happy to say that we've had a lot of achievements, and as you have with all organizations, we have had challenges too. And the good news is that one of the best tools being deployed to address our challenges has to do with digital health financial solutions. And so once again, it's an honor to be here to speak to you about digital health financing innovations in Ghana and how they are supporting the progress at the National Health Insurance Authority towards achieving universal health coverage. Over the past 30 years, through strong political, legislative, and fiscal action, Ghana has instituted health system reforms to make progress towards UHC. The National Health Insurance Scheme, which was introduced some 20 years ago by the then government, is a social intervention program to provide financial access to quality health care for residents in Ghana, and has a membership of about 55% of Ghana's population, that comes to about 70 million people. The scheme is heavily tax funded, with only 7% of the inflows coming from premium collections and processing fees. The National Health Insurance Authority, which runs the scheme, has the mandate to provide financial risk protection against the cost of quality basic health care to all residents in Ghana and to propel the country towards the attainment of universal health coverage. Ladies and gentlemen, we are all aware that UHC is a global goal to ensure that all people have access to quality, affordable healthcare services without financial constraints. Ghana is committed towards achieving UHC, and we have a strong view that innovations in digital health financing can play a critical role in helping us achieve UHC by 2030. Ghana has made significant progress in developing and implementing digital health financing innovations in recent years. The NHIA, that's the National Health Insurance Authority, has been at the forefront of this effort and developed several innovative solutions to improve access to and affordability of healthcare services for all residents in Ghana. The mobile renewal system, the e-receipt system, the electronic claims management system, and the My NHIS app are some of the key digital health financing innovations implemented by the authority in the last few years. The NHIS electronic receipts platform and mobile renewal of membership service, for example, are two technological solutions that have enhanced our membership registration and renewal process, streamlined cash collections, and improved efficiency in revenue generation, as well as prevented corruption when it comes to the collection of premiums. The mobile renewal system, introduced in 2018, allows all residents in Ghana to renew their NHIS membership at their own convenience using their mobile phones. With a dial of a short code, *929#, all mobile phone network users can easily and conveniently renew their NHIS membership and that of their loved ones. This has eased the queues that used to dominate in our district offices and also saved our members a lot of time that was wasted in trying to access the membership cards or to get registered onto the scheme. Policy validity of a member could be checked on the same mobile platform by dialing *929 option 1. So it's possible to just dial a code on your phone and you get to know whether your policy is valid or it is about to expire so that you can renew on the phone. In December 2022, we launched a new app which is available on Google as well as iOS, and this allows you to download our app, and with the app you are able to register for the first time. So before 2022, if you want to register onto Ghana's health insurance, you have to physically visit any of our offices to register. But with this app, it is possible to use your national ID card and to onboard onto the scheme without visiting any office. And I'm happy to say that we are able to do this because Ghana has introduced a new ID system called the Ghana Card, which was introduced by the current government, and it is being spearheaded by the current Vice President. Now, this card is similar to the Deutsche Personal Ausweis that you have in Germany. The My NHIS app therefore helps to improve communication between the patient, the providers, and the payer, that is the National Health Insurance Scheme. Now, I'm happy to say that there's a joint project between the National Health Insurance Authority, the Kwame Nkrumah University of Science and Technology, the Technical University of Berlin, that Prof will speak about. We are working on a REACH UHC, which is a project that is supposed to pilot a system that will remind members on the scheme on their policy expiry, so that we don't have to sit and wait for members to go off the scheme and go to them and ask them to come back on the scheme. In fact, this project is looking at the possibility of automatic renewals so that all members on the scheme can be automatically rolled over instead of the current system where we have to sometimes wait, they go off the scheme and they have to come back to the scheme. The aim is to implement a mobile phone-based intervention to increase population coverage, increase mobile renewal, and reduce the non-renewal or defaulters ratio on the scheme. This intervention will introduce interactive voice response IVR for auto renewal of membership and has the potential to increase health insurance membership, especially among the informal sector. Now let me say that about 65% of all our members onboard through the mobile renewal system. You can imagine 65% out of 70 million. That's about 9.8 million. And so it's a very key, significant intervention that we are working on with the University of Berlin. One other intervention, digital solution that we've introduced is the online credentialing application. So we have over 5,000 facilities, majority being hospitals and a few laboratories that are credentialed with us. It means that they offer services to Ghanaians and then we reimburse for the care that they give. And they used to come to us manually to get their credentialing done. But with this online credentialing system, it is now possible for them to go online, onboard the necessary documents, and they get credentialed on the line. So this helps to save time, and it also helps to avoid a situation where some of them want to provide services, but because they are not credentialed, they have to let go or avoid our clients. One other solution which we have deployed is the electronic claims management. So I'm happy to say that, you know, in my other life, I am a politician. And when I was in opposition, I used to make a lot of noise that the National Health Insurance of Ghana was not efficient because only 10% of their claims management process was digitized, with over 90% being manual. And so when a Ghanaian visits the hospital and is treated for, let's say, malaria, they have to physically bring documents that has been seen by staff of the authority. And that was open to a lot of corruption and inefficiency. And so when we were in opposition, we used to make the argument that should we come to power, we are going to make sure we turn it around. 90% of the claims process ought to be digitized, with just about 10% room for manual processing. And I'm happy to say that since coming to the authority, we've pushed hard on this, and today, as we speak, about 90% of the claims process is digitized using a software called Claimit, where hospitals are able to feed in the claims of patients electronically, and this saves time when it comes to the vetting process that we do at the authority. And so that is a very significant deployment. The goal is to achieve 99% electronic claims management by 31st December of this year. And I think that is very, very possible. So I think the benefits are enormous. With a digitized claims process, you are able to quickly vet claims and pay on time. And I think one of the biggest challenges we had at the authority was that it takes sometimes 6 months to a year before we pay for services that have been offered. And immediately you have such a wide gap, then providers or the hospitals are forced to take money from clients. And then you end up defeating the process of social or health insurance. So some of the advantages of the electronic system for claims have been mentioned here. You have faster processing time for working on claims. You have a cost benefit to the provider because of reduced paper and printing costs. Now we're able to do a lot of data analysis because now you have electronic records. You're able to work on the data. There's also transparent processing. So it is quite easy to go back for any claims that is controversial and do an audit. There's also a reduced errors. Definitely the machines make less errors compared to the humans. And I'm also happy to say that this also creates the foundation to go strongly into artificial intelligence, because with the trends and patterns, you are able to project into the future. The NHIA is involved in several digital health financing solutions that we are working on. Key amongst them is the, we call it a biometric validation system. So what is interesting is that Ghana has run health insurance for the past 20 years, but all the claims that we pay for the supposed care is not verified. And what do I mean by not verified? So we get a lot of claims that say that these number of people have attended hospitals, but we don't have any empirical evidence that they actually presented to the hospital and were seen. And should I say I'm happy to say, I don't know whether to say I'm happy, but in Ghana, we've had a few hospitals prosecuted in court for having presented fake claims. So what it tells you is that some of the payments we make might not be genuine. And so what we are trying to do now is to deploy a solution where every person who goes to the hospital, who is on our scheme, would have a biometric validation. So that in my office, I can tell that this hospital had 100 people verifying for having attended the hospital. And technology is the best way to bring in efficiency and to bring down corruption if there is any. Another solution that we are looking at is how to connect our hospital payments, claims payment, to the authority. And lastly, we have introduced what we call the sunshine policy in Ghana. So until recently, all the monies that are paid to providers or hospitals for the care is known only by the provider and the payer. The patients, who are those who visit the hospitals, don't have information. And so what this leads to is that when providers engage in illegal acts like taking money from people who are already on the scheme, the excuse they give is that they've not been paid for over a year and nobody has a means to verify. So we've introduced this policy where now the fine, we pay an average of $10 million every 30 days at the insurance for care, every 30 days, $10 million. Now, what we've done is that the file of payments now is published on our website. So if you go to, right now you go on your phone, you go to NHIS, nhis.gov.gh, and you open the website, you go to the top left corner and you click the options, you see claims payment. And when you click on claims payment, you can type the name of a hospital and the district, and you can see what they have received in the last 3 or 4 months. And now it has shown light, transparency. So now the hospitals are careful to tell people that they've not been receiving payments. And this brings confidence in the system because the patient also can check and know that this hospital I've been attending, they just received some payments a week ago and they even have the volume of the payments. And this is good news for all of us. In conclusion, I am pleased to state that the National Health Insurance Authority's digital health financial innovations are already making an impact on Ghana's road to achieving UHC in 2030. The e-receipt system, the sunshine policy are all in place and being rolled out. The My NHIS app is making it possible for people to register. And as we speak, we have over 50,000 downloads already. This has shown overwhelming interest in our digital solutions. We are still in an early stage. 30 years is not that old, it's young. 20 years is not that old, it's young. And we are committed to learning more and improving. At the National Health Insurance Scheme, we believe that digital health financing innovations have the potential to transform healthcare systems around the world. It is for this reason that all these IT solutions are being worked on. Ladies and gentlemen, the road to modernity is very similar to the pathway that leads to UHC. Digital health solutions define that highway to total healthcare. It's been fetish. Thank you.